Okay, so we will see low flow anesthesia. We will see it according to the points, like definition first, then according to which it is classified, मॉनिटरिंग कैसे करना है, टेक्निक्स क्या क्या है, देन हाउ टू मेंटेनेंस की टेक्निक्स, देन टर्मिनेट कैसे करना है, उसके एडवांटेजेस डिसएडवांटेजेस एंड फैक्टर्स अफेक्टिंग द लो फ्लो एनेस्थेशिया, इस पॉइंट्स में अपन डिस्कस करेंगे. सो लेट्स स्टार्ट. डेफिनेशन. लो फ्लो एनेस्थेशिया. Wait. Okay. Low flow anesthesia is a technique which uses fresh gas flows less than minute ventilation. It is a technique in which at least 50% expired gases have been returned to lung after CO2 absorption. And most of the practical consideration में fresh gas flow of 2 liter per minute is called as low flow anesthesia. तो इसको किस बेसिस पे डिवाइड किया है अकॉर्डिंग टू बेकर्स क्लासिफिकेशन. सो इसमें मेटाबॉलिक फ्लो, मिनिमल फ्लो, लो फ्लो, मीडियम फ्लो है. Metabolic is 250, minimal is 250 to 500, low flow is 500 to 1 liter and medium flow is 1 to 2 liters. अभी equipments. तो circuit with CO2 absorber लगेगा to reutilize expired gases required. Okay, so two circuits commonly used are to and fro circuit by Walters and closed circuit by Brainsford. To and fro circuit ऐसे रहेगा, consist of single channel for inspiration and expiration, and this is closed circuit. This is closed circuit. Now the advantages. Advantages are simple. It is simple and requires minimal breathing components. Resistance to spontaneous breathing is minimal. Easy to clean and sterilize. Disadvantages are cumbersome है, heavy near the patient head end. Head end पे बहुत heavy रहेगा. Difficult to manage, of course, especially the oxygen absorber. Possibility of inhaling soda lime dust is there, and increase in dead space. Dead space increase होगा of apparatus as soda lime is exhausted. Okay, definition देखा, Baker's classification देखा, equipments, then monitoring. How to monitor? Inspired oxygen analyzer. Inspired oxygen analyzer when N2 is being used. Monitoring of end-tidal anesthetic concentration by mass spectrometry, Raman spectrometry, Raman, photoacoustic surface absorption, and infrared absorption. Now we will see the techniques of the low flow anesthesia. First is loading, then pre-filled circuit, then using large dose anesthetic and injection techniques. Loading, pre-filled circuit, large dose anesthetics and injection techniques. Loading. In loading, we use the high flows for a short time. 10 liter per minute flow with up to 2 Mac concentration. At the end of 3 minutes or 3 time constant circuit brought to the desired concentration. Okay, at the end of 3 minutes per 3 time constant circuit is brought to the desired concentration. It is the commonest and most effective technique, and the disadvantages are that of high flows and OT pollution. Loading is done. Second technique of low flow anesthesia is pre-filled circuit. Pre-filled circuits we use two circuits. The first circuit is Magel circuit used for pre-oxygenation, and second circuit is circuit fitted with test lung and entire circuit filled with gas mixture of desired concentration. Following intubation, circuit is connected to the patient. The third technique is using large doses of anesthetics. Fresh gas flow started with metabolic flow of oxygen and large amount of N2O. Okay, the oxygen concentration which falls in is the oxidation the oxygen concentration which falls is continuously monitored and N2O flow reduced once desired oxygen concentration is achieved. Seldom use is increased chances of hypoxia. Okay, हाइपोक्सिया के चांसेस इंक्रीज होते हैं, इसलिए सोच के यूज करना है. सेटिंग इन वेपराइजर ब्रॉट टू 0.5 to 0.8 आफ्टर 10 minutes. अभी इंजेक्शन टेक्निक. It is extremely reliable method. Injection of the agent directly into the circuit. So 1 ml of halothane gives 226 ml vapor at 20 degrees Celsius, and 1 ml of isoflurane gives 196 ml vapor at 20 डिग्री सेल्सियस। हेलोथिन 226 देगा और आइसोफ्लोरिन 196 देगा। 226 and 196 at same temperature. Around 2 ml agent injected in graded aliquots into circuit. Injection through self-sealing rubber diaphragm covering one limb of a metal T-piece into either inspirator or expirator lip, and wire mesh or gauge piece inside the T-piece helps in vaporization of the metal. The four techniques we have seen: loading, pre-filled circuit using large dose of anesthetic, and injected techniques. The most commonly used is loading and the most reliable is injection technique. अभी मेंटेनेंस कैसे करना है? मेंटेनेंस ऑफ द लो फ्लो एनेस्थेसिया. फर्स्ट मेथड इज गोथेनबर्ग टेक्निक एंड सेकेंड मेथड इज इंजेक्शन मेथड्स ऑफ केनेडी एंड लोए. गोथेनबर्ग टेक्निक इज इनिशियली हाई फ्लो देंगे, ऑक्सीजन 1.5 लीटर पर मिनट and into 3.5 liter per minute for 6 minutes after induction. It is called loading phase, followed by oxygen 4 liter per kg per minute, and to adjusted to maintain the oxygen concentration around 40% in the circuit. This is detected by oxygen analyzer, which is thus very important. सो इसमें दो फेजेस में गोथेनबर्ग टेक्निक दो फेजेस में करेंगे. फर्स्ट इज लोडिंग फेज, जिसमें ऑक्सीजन एंड नाइट्रोजन का लोडिंग डोज देना है. ऑक्सीजन 1.5 लीटर पर मिनट इनटू 3.5 लीटर्स पर मिनट फॉर द 6 मिनट्स आफ्टर इंडक्शन, फॉलोड बाय ऑक्सीजन देना है 4 लीटर पर केजी पर मिनट एंड इनटू एडजस्टेड अकॉर्डिंग टू द ऑक्सीजन कॉन्सेंट्रेशन, क्योंकि ऑक्सीजन कॉन्सेंट्रेशन 40% मेंटेन करना पड़ेगा. दिस इज डिटेक्टेड बाय ऑक्सीजन एनालाइजर, विच इज दस वेरी इंपॉर्टेंट. In the absence of oxygen analyzer, क्या करना है? Use 10 liters per minute for 3 minutes, followed by 400 ml per minute oxygen and 600 ml minute N2O for 20 minutes. 500 ml oxygen and 500 ml N2O thereafter. This maintains the oxygen concentration between 33 to 40% at all times. Okay, this is Gothenburg technique. And second is injection method of Canadian Loy. For halothane in a 50 kg patient, 0 to 5 मिनट्स में 27 ml पर देना है, 5 to 30 मिनट्स में 5.5 ml पर आर, 30 to 60 मिनट्स में 3.5 ml पर आर, 60 to 120 मिनट्स में 2.5 ml पर आर. ये थे मेंटेनेंस टेक्निक्स. नाउ टर्मिनेशन ऑफ द लो फ्लो एनेस्थेसिया. इसमें है दो टेक्निक्स, हाई फ्लोज, एक्टिवेटेड चारकोल. हाई फ्लोज में एट द एंड ऑफ द सर्जरी ओपन सर्किट use high flows and let out the agent, cause wastage of the gas or OT pollution. ये चीज़ें हो सकती है. एक्टिवेटेड चारकोल देना है. एक्टिवेटेड चारकोल heated to 220 degree Celsius absorbs volatile anesthetics, and charcoal containing canister with a bypass placed in the circuit at the end of the surgery. Gas is directed through this canister. Okay. Advantages and disadvantages. Advantages: economical है, humidified gases are provided, maintains the body temperature in long surgeries and less OT pollution. Disadvantages क्या है? तो accurate adjustment of fresh gas flows लगेगा, accumulation होंगे trace gases के, ऑक्सीजन एनालाइजर लगेगा, एक्सपायर्ड गैस मिक्सचर एनालिसिस करना पड़ेगा, रिस्क ऑफ हाइपोक्सिया इफ लीक होता है, एंड इफ ऑक्सीजन फेलियर होता है तो भी ये होगा क्या? हाइपोक्सिया. प्रिकॉशंस क्या लेने? Leak should be sought during maintenance phase. Most gas monitors sample gas at rate of 200 ml per minute, which may be more than half fresh gas flow. The sample to be returned back to the circuit to maximize fresh gas flow utilization. Now finally we will see factors affecting low flow anesthesia. During initiation, during maintenance. During initiation, factors governing inhaled tension of anesthetic, factors responsible for increase in alveolar tension of volatile anesthetic, and factors responsible for uptake from lungs. Now we will see factors governing inhaled tension of anesthetics. Volume of circle system, usually 6 to 7 liter. FRC of lung to be nitrogenated, around 3 liter, and diffusion of anesthetic through rubber tubes. Factors responsible for increase in alveolar tension of volatile anesthetics, concentration effect, and minute ventilation. Factors responsible for uptake from lungs: blood solubility of volatile agents, that is blood gas partition coefficient, cardiac output, and alveolar venous partial pressure gradient. During maintenance, कौन से factors affect करेंगे? Delivery of the hypoxic mixture, steady alveolar anesthetic concentration to be maintained, and two theories to explain volatile anesthetic uptake, that is exponential theory of low A and linear theory of